This season many kids are getting hand, foot and mouth disease. So parents must be wondering what this hand, foot and mouth disease is about. Is it dangerous? What are the signs and symptoms? How do I prevent them? Can I send my kid to school? All these questions must be going on in your mind. So hand, foot and mouth disease is a viral disease. Usually 3 to 6 days after contact with an infected person, a child develops fever, sore throat, runny nose, and within a day or two, the child will develop blisters on the hands, feet, buttocks, and even ulcers and blisters in the mouth. So, the fever lasts only a day or two. Is this disease dangerous? Very, very, very rarely there can be involvement of brain and nervous system, but that is extremely rare. What age group of kids get this disease? Usually it is the infants and below 5 years age group kids, but even older kids and adults can get. How do they get it? So suppose I have hand, foot and mouth disease. I sneeze and somebody is standing within 3 feet of me and these droplets fall on the face or mouth. Yes, the other person can get the infection. Or I use a napkin to blow my nose and somebody else touches it and touches his or her face and mouth, it can spread. Suppose I drink water from a tumbler and the other person shares it, again he can get. So, and it also spreads through the stools. If I clean somebody's diaper and that child had hand, foot and mouth disease and I don't wash my hands properly and handle another child's face and mouth with the same hands, it can spread. A child had sneezed on the surface, say a chair or table, and I didn't clean it. And some other child comes and now touches the surface and immediately touches his face or mouth, again it can spread. So how to prevent this hand, foot and mouth disease? First and foremost, strict hand wash using disposable tissues to clean the nose, and if they are not available, the child should be taught to sneeze over his shoulder. And surface cleaning and cleaning of toys handled by the child. These are very important measures, and hand wash after the child uses the washroom is also very important. So how do I treat this child? Yes, if the child has fever, please give paracetamol or other fever control medication as advised by your doctor. The child may have intense pain in the mouth. So if the child is 1 year plus, you can use soothing mouth washes, and if it is a child less than 6 years, you should put only few drops in the mouth. If it is an older child, you can put up to 1 teaspoon of mouthwash, but it should be a soothing one. It will also have certain anesthetic action so that the child doesn't feel any pain. So you can even apply this before the child eats food. Maintain good liquid intake. The child may refuse to eat and drink, but somehow you have to ensure good liquid intake. Don't give anything which will irritate his or her throat. If the child's liquid intake is inadequate, we may have to admit the child so that the IV fluids are given and the hydration is maintained. So good liquid intake, good temperature control and soothing mouth washes for the mouth are the key to helping these kids. Some of them may have very itchy blisters, for which certain soothing calamine based lotions can be applied to relieve the itch. Anything beyond this, it's better you consult the pediatrician. Can I send my child to school? Yes, but the child should not be having fever. All the blisters should have dried up. He shouldn't be drooling too much and he should be very comfortable, and the teachers also should be ready to take care of the child when they are managing so many kids. So After this 1 week of illness, when all the blisters have dried up, is my child non-infective? No. The child can still spread the infection up to 1 to 3 weeks from the secretions of the nose and mouth, and for up to months through the stools. But still, we cannot stop the child from going to school after this 1 week, provided fever has subsided, child is active, and there are no open blisters and there is no excessive drooling. Thank you.